Okay, today I'm talking about the bones of the pelvis, the thigh, and the knee. So first, I'm gonna talk about the bone of the pelvis. So this is the ilium, and this is the ischium, and this is the pubis. And we go to the thigh. This is the femur. This is the shaft of the femur, the neck, the head. This is the greater trochanter, and this one is the condyles. This is the medial and lateral epicondyles, and also the condyles. And this one is the kneecap or the patella.
So now I'm gonna show you the ligaments of the knee. So there are 4 ligaments for the knee. That's the ACL, PCL, MCL, and LCL. And they are divided into cruciate ligaments and collateral ligaments. The cruciate ligaments are ACL, that's the anterior cruciate ligament, and the PCL is the posterior cruciate ligament. Here you can see the posterior cruciate ligament, that's the PCL, and the orientation for it is the superior, anterior, medial. And here you can see the anterior cruciate ligament, and the orientation for it is superior, lateral, posterior. Now, these are the collateral ligaments. This is the medial collateral ligament, that's the MCL, and this is the lateral collateral ligament, that's the LCL. And the medial collateral ligament connects the medial epicondyle of the femur to the medial side of the tibia. And this is the lateral collateral ligament, and this connects the lateral epicondyle of the femur to the lateral side of the fibula. So in this picture, you can see that this is the posterior cruciate ligament, and this is the anterior cruciate ligament, and this one is the medial collateral ligament. Here it's written tibial collateral ligament, and this is the lateral collateral ligament. Even in this picture, you can clearly see the posterior cruciate ligament, and here it is the anterior cruciate ligament.
To clearly picture out our muscles in the anterior compartment of the thigh, we have drawn these muscles. So as you can see, this is the sartorius muscle. So what I've said earlier, it comes from the lateral side of our pelvis towards the medial side of our leg area. Also, this is the rectus femoris muscle, this one. This is our vastus lateralis, and this is our vastus medialis. So there are 3 vastus muscles, but one muscle cannot be seen superficially. So the vastus intermedius is seen on the deeper portion. As you can see in this area, this is our iliopsoas muscle. This is our pectineus muscle. This is our adductor longus, and this is part of our adductor magnus muscle. This one on this area, this is your gracilis muscle. So the gracilis muscle is on the medial side or the medial compartment of our thigh. On the lateral compartment, you can see this is your tensor fascia lata muscle, and it extends downward, forming our iliotibial tract or band. So now I will be talking about the origin and insertion of muscles as well as their actions. So we will be starting with the flexor muscles. So the flexor compartment is on the anterior side, so it's on this side. So we will be starting with our iliopsoas muscle. So the iliopsoas muscle, this part here, it originates in our lumbar and thoracic vertebrae, and it will insert into our ligamentum teres. Our sartorius muscle, the longest muscle, starts from your pelvis or your axis in your iliac area, going to the medial aspect of our tibia. Next, we have the quadriceps muscles. So, the rectus femoris, it originates in our anterior inferior iliac spine, going to our patella. So, the quadriceps muscles forms our quadriceps tendon, which would insert in our patella. Another part of the quadriceps muscle is our vastus lateralis, your vastus intermedius, this one, and your vastus medialis, this one. So these three muscles, the vastus muscles, originates in the shaft of the femur, and it will still insert to our patella. On the posterior part is our extensor muscles. So our extensor muscles, we have the gluteus maximus, which originates in our outer surface of the ischium, sacrum, and our coccyx. It will insert in our iliotibial band or the gluteal tuberosity. Our hamstring muscles, which are our one of the major extensors of our leg, are composed of our biceps femoris, long head and short head, semimembranosus, and your semitendinosus. So these muscles originates in our ischium area, and the semimembranosus and semitendinosus would insert in the medial condyle of our tibia, and our biceps femoris muscle, both the long head and the short head, would insert in the head of our fibula. Okay, our medial rotators and abductors are our gluteus medius and gluteus minimus, which originates in our ilium and inserts to the greater trochanter, so here. We also have one medial rotator, which is the tensor fascia lata, which originates in our iliac crest and would insert to the iliotibial tract. Talking about the adductor muscles, so we have the adductor magnus, adductor longus, adductor brevis, pectineus, and gracilis. So all of these adductor muscles originates in our pubis. It will insert in the linea aspera of the femur, so this part here, except for our gracilis muscle, which would insert in our medial shaft of tibia, so this part over here.
Femur thigh bone, longest and heaviest bone of the body, 1/4 of individual's height. Condyles of femur radialis longer, lateral broader and more anterior. Patella kneecap largest sesamoid bone. Contains the biggest layer of cartilage. Tibia shin bone, medial bone of the leg, transmits the weight of the entire body. Fibula, cuff bone, split bone, most slender bone. Lateral bone of the leg it is. Bones of the foot, 26 bones are. Tarsals is 7, metatarsals is 5, and the remainder are phalanges is 14, 26 bones of the foot.